such causes.
I know, but when was this found out?
It was actually taken through the numerous cases by Dr. Praful Vijayakar. He is a doctor practicing in Mumbai. Recently he had passed away, and he had, I think he had at the age of around 70s. He was, till that he was learning many cases at his clinic in Mumbai. And he enquired the details and looked into the history of the maternal pregnancy period and all. And it is said, and many, we have many babies like that. So we have homeopathic medicines telling like the mental sphere of the mother.
This doctor is a homeopathy doctor?
Yeah, yeah.
Oh.
So he has a different concept, and this works well.
Oh.
So if suppose the mother is having a feeling of fear or fright or something like that, like domination and all, we have some rubrics like we have a dictionary like covering the mind symptoms. Everything is there. When we look into this mind symptoms, mind fright after being some shock or something like, we have some remedies for that. And when the remedy is given to the mind, mother, the child is getting better.
Oh.
Yeah.
Even during pregnancy? Or
Even
after?
after the child is born.
Oh.
Actually, it's a wonder, but it works.
I know. I'm quite struck by that wonder.
Yeah. But once we go into the deeper, when we think it's quite natural, no ma'am. Once the mothers are affected, it's going to affect the baby.
I know,
We have some
but I didn't
emotions
know.
that is going to affect the baby.
What I didn't know was that it affected the baby even before he was born.
Yeah, of course, because they even tell that it is not only the mother who is getting pregnant. Even before the conception happens, the father has a period of pregnancy, they say, because the sperm has to be formed within the. When we look into the details, we can understand that the quality of the sperm also influences the health of the baby. So the father also has,
that is common knowledge.
yeah. So the father has a period of pregnancy by which the sperm is getting prepared. And after fertilization, actually mother is having a period of 9 months, and by the time the organs are formed in the first trimester, and during that period, if something affects the mother, it is going to affect the organs of the baby. And if it is during the later period, it is going to affect the functions of the various organs that has been formed during the first trimester.
Oh, it's a great this thing.
So we're taking the case like that, and we're giving
We
medicine.
were, when we studied, we were taught that the child, baby, is affected by the mother's womb, and the child is affected even before he is born. So we were all quite struck because our thing is
during knowledge was limited, no?
Limited, and nobody was really going to be hurt during pregnancy. And this concept of father being included is there in the Upanishads.
Oh, which thing?
Pitrugarbha, we say.
Oh, that's great.
Yeah, his basics are from that Upanishads only. And it is really
ancient literature. We have talking about, as I said, it is not the Matru Garbha, the Pitru Garbha. He is already there in the father. And before, it is just like some plants needed to be transplanted, put in a different thing to grow. That we all know about we all know about rice and how it grows, and then there is a period when we say in art we say and you have to replace it. So that concept of something which is not completely grown is being transplanted into something else, and it grows to its full stature later. That is common knowledge. Almost everybody involved in this work is but the concept of the Pitrugarbha, it is there already in the father, and it grows there, is something which we all kept wondering why the Upanishad is talking like this.
Actually, it is the time for the father for preparation of the healthy sperm. We can understand that by when we have when an alcoholic is having a baby, his quality of the sperm will be not good because it has been destroyed by the effect of the alcohol, and it certainly affects the baby. So from that such effects, we can understand the importance of that paternal pregnancy.
That is a common feature when you learn the Upanishads or the Vedas and things like that.
Yeah.
But somewhere along the way, I think it is because of the influence of the Western world, we have lost it. It has gone, otherwise it is there. And when I read about it, I laughed because that was never given to us that way. So I laughed. I said, what is this nonsense about Pitrugarbha?
But now you can think about it.
Now,
Man, that's why this applied Montessori is having a finest system in the special education, special care education, the Montessori apparatus and the methods and practices, philosophies we can apply. Yeah. That's why this Montessori remedial educator we are introducing instead of just like these Montessori directors in the special education sector. I think Maria Montessori started this.
Special education.
Yeah.
Because they didn't want to call it a remedial education. They didn't want to do something that is called the children. You know, we in Montessori we believe if the child is what would I want to say? Not up to the mark, not developed according to the schedule we have got. We have got a schedule saying the child should do this at this age and this. We have got a schedule. And so, when the child does not follow the rules, we say the child is retarded, the child is underdeveloped. All these concepts come.
But here we are not addressing them as the special children or differently able or disabled, but we'll call this remedial method for the solutionary part.
That's what I'm trying to say, that we don't want to label them. We don't want to put a name to that.
But remedy is a positive word, no? Remedy. Remedial.
In a way, it is all right, but not totally. But remedy is when something goes wrong.
But it's a solution, really.
Many children have parents who don't understand that their child is not normal.
Yeah.
They
But here,
think, and they all also say, oh, children are always like that.
here, ma'am, we are just training the teachers in that way as to apply this Montessori apparatus and methodology and the practices principles in the special education. That's only. Otherwise, people are not using the method for that purpose only. And we are not labeling the children. We are labeling only the teachers as the remedial educators, not for the children. We are labeling children as the gifted.
Yes.
Yeah.
And no.
Yes. And
Ma,
I will take that.
no, don't worry.
Yes.
I have to have my tablets.
Tablet. Okay.
ಔಷಧಿ ಕೊಡ್ತೀಯಾ?
ಇಲ್ಲ.
ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಇಲ್ವಾ ಈಗ?
ಇಲ್ಲ. ಹೇಗೆ ಕೊಡಿ?
ಎಂಥ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಇಲ್ವಾ?
ಯಾವುದು ಇಲ್ಲ.
ಸರಿ, ಇದು ಕೊಡ್ತೀಯಾ?
ಏನು?
You are absolutely healthy, without tablet. So young and energetic.
Yes. But I have a chronic diabetes. ಇಲ್ಲ, ಸ್ವೀಟ್ ಕೊಡ್ತೀಯಾ? ಕೊಡು.
Now, in this special education, we are not labeling children as, but labeling the directors.
I am not very happy about what you are saying. Because it may be that you are not labeling,
Yeah.
but the parents keep saying,
Yeah.
I've got an underdeveloped child. I've got a...
Yeah. Then which word is the right one to address the teachers or the remediators, those who are involved in this?
I think we have to find a new word. But finding a new word is easier. Spreading that is difficult.
Yeah. What
They
about?
will think that there is something new in the child.
What about seedler? Seedler, ones who put seed into the mud, seedler is called, teacher is called as seedler.
It is not the problem of a seed, but it's a problem of development. Which is
That's why it's called educator, no?
By what reason we don't know, but it has harmed the child.
Educator, no? As an educator.
The education, unless we are able to identify.
Mentor.
I laugh at that mentoring.
It's a common word used.
No, it's nothing about the word, nothing about the word. But when you are going to talk to a parent who has got a retarded child, and you tell the parent what she should do or what he should do, they fail to understand it. They don't want to accept the fact. Most of the time I find it, there is a barrier there. They don't want to accept that their child is not normal. Because if they are very, very, very abnormal, then they have to accept it. But many children are only slightly in one area only. I had a cousin. I should say I had. I should say I have, because she's still there. Both of us grew up together. But in certain areas, she'd say, you study. I don't want this. And she'd go and say, I'm going to take my bath, or I'm going to eat, I'm going to the toilet. Things like that, she'd try to escape. It is only later we found out that she had an anathema to that subject. She didn't like it. So she'll escape. That was when she had grown up. But as a child of 3 who doesn't like something, what will he do? The adult will force it on her, the child. Adult will say, no, you have to study. Even chanting our mantras, chanting our, not the mantras, but our shlokas or things like that, are forced on the child. And that force is going to that we inflict on the child is going to have a reverse action, and the child suffers. The parent, we tell them, please don't do it. They won't accept. They say, you don't know. If I don't do this, the child won't learn this. Child won't learn this. Yes, I know that it is a very normal thing for anybody to say, Om Namah Shivaya. Very normal. It's in public places also they are going to say that. But if a child does not want it, why are we forcing it on him? I understand. I studied I should put it in present tense. I study the Vedic literature, and Namah Shivaya has got a great potency according to the Vedic literature. I believe it. But if a child doesn't want to accept it, how is it that I can force? How is it I can put it down his throat, as we say?
That's right. Then, ma'am,
And what is
it's
the exact right method in such cases? What we should do in such cases?
Sorry.
In such children, what is the right way of teaching them or coming?
special attention needed.
Teach something else.
So how can they come into the mainstream, learning common basic subjects and all?
As to
They
cope up
are
with
not,
the normal.
learn it by
May I ask you, what is the mainstream?
some basics of mathematics and all. If the child is not getting interested,
I see now that I am not what everybody is at. I am away from the mainstream. So you have to test me. Each child has got his own pattern of growing, his own pattern of developing. You can't say this is how you have to do it.
Yeah.
There is absolutely no specific rule.
Yeah, that's why, ma'am, we are using.
Human growth and development.
Yeah, that's why we are using the Montessori methodology for that. That is the
I
right
agree.
methodology.
That I agree.
Yeah. That's why we are suggesting Montessori methodology for the special education. And so, if it is not labeled like a remedial educator, it will not, things will not work. That's why this terminology is using onto that extent only.
Yes, that is true.
That's why in the last conference of this Montessori conference held on 26 January in Kerala, is decided to start a program not for the children lab, it's called Montessori Remedial Educator, MRE program, for educating these need and relevance of Montessori method in this special education.
But I am talking about the one step prior to that.
Yeah.
How do you identify the child as a person who needs special education?
Due to this pandemic, some academic loss happen, no? As to they are following some syllabi like CBSE or ICSE and the state board and all.
You talk so much about me. Let me say something about myself.
Yeah.
I must have been about 8 or 9. My father, mother, both of them were in Delhi. Papa had work in Delhi. So we were with the grandparents. And there was a music teacher. Every day we come from school, have something to eat. This gentleman will be sitting there, already ready for the lesson. My cousins had to go. I was also supposed to go. I would escape. I hated the music class. So I didn't want to go and sit there. To learn music. Now Amma came from Delhi. I told Amma, please stop my music lessons. Don't pay the master. I am not going to learn. Amma said, no, music will be with you all the time. That is one thing which is going to be in your young age. It is going to be there when you grow older. It will be there even when you are very old. Amma said that to me. I said, it may be true, whatever you say is true, but I don't want it. I don't like it at this moment. So I stopped going to the music lessons. Do you want to label me perverse? Do you want to label me underdeveloped? You want to name me whatever. Whatever you want to name me, you can do that. But now, as Josephine remarked about it,